This is something to talk about from the Bainbridge Island Senior Community Center. Several times a week, usually on Monday, Wednesday, and Friday, we get together. Today, we're going to be hearing from Kim Hendrickson, who works with the Poulsbo CARES program to talk about non-emergency calls through the Poulsbo Fire for services involving mental health and substance abuse. Before we get started, I want to thank Fieldstone Memory Care of Bainbridge Island, which is a sponsor for these programs. Fieldstone offers innovative and compassionate care. They have day stay and respite care programs as well. To learn more and tour their facilities, or to learn about the independent living and assisted living that is under construction right now, call 360-689-4314. And I'd like to acknowledge that the Senior Community Center is on the ancestral homelands of the Coast Salish people, specifically our neighbors, the Suquamish tribe. We are grateful for their hospitality, and we honor them, the people of the clear salt water. To help frame our discussion, Ann Lovejoy is here. Ann, could you introduce Kim?
I certainly can. I'm very happy. Well, actually, Kim, would you like to introduce yourself and tell us what your position actually is and what you're actually doing?
I'd be happy to. Thank you. It's complicated, so I don't want to give anybody the burden. Kim Hendrickson. I work for the city of Poulsbo, and I'm here in a relatively newly created position and new department called Housing, Health, and Human Services. So the city of Poulsbo, our council and our mayor saw fit back in 2020 to add this department to the city. And as Director of Housing, Health, and Human Services, one of my primary duties, and probably the one that's closest to my heart, is being the project manager of the Poulsbo Fire CARES team that Reed just mentioned. So, I'm going to talk today about Fire CARES. I think it's going to be of interest to folks at the Senior Center and folks interested in seniors and seniors themselves on Bainbridge. But I hope as part of this conversation, we can also talk about how cities can serve their seniors more broadly. That's a topic of really high interest to me, and we've got some other initiatives happening here separately from the Fire CARES program. So happy to join you. Hello.
Oh, those are all perfect things that we are extremely interested in. I guess, maybe just start out by explaining, So maybe we can start off just by talking a little bit about what the CARES program is and how Poulsbo is using it, if I can put it that way, because I see that it presents differently in different communities.
Yeah, and Anne, if you would permit me just a few minutes of kind of background before I talk about the specific program, it might make a little more sense to your viewers.
Sure, absolutely.
Thank you. I'll just give some quick framing comments here. I don't know how many folks that are watching this know, but a high percentage of calls to 911 involve behavioral health issues. And I certainly didn't understand how frequent 911 is used to address things like anxiety, suicidal behavior, cognitive decline, substance use, loneliness. I hadn't realized that until I got into this work. It's really hard to put a number on it in terms of a percentage. It depends what season it is and who you're asking. But certainly if you ask folks in the fire service or on the police side, how many of your calls on a daily basis relate to behavioral health? At a low end, the number will be 10%, but I've heard people tell me it's half the calls that they're going out on. So clearly there is a need to better equip the fire service and the police departments, not only here, but all over the country, to respond to calls involving behavioral health issue. So for many years, the city of Poulsbo developed a program over on the police side called the Police Navigator program, where we paired our police department with a social worker or a mental health professional. And I'm so happy to say that, Bainbridge Island picked up that program, as you know, because I think you've interviewed her. You've got wonderful Kelsey Lynch over in the police department serving as a co-responder with the police department, which is great. But I realized several years ago, there are so many people that are struggling and calling 911 that have nothing to do with law enforcement. No crimes, no danger, but needing help and calling 911 and getting a fire response and not police. So City of Poulsbo decided a couple of years ago to partner with the Poulsbo Fire Department to build out a program that has some interesting similarities to the Police Navigator program, but really is quite distinct as well. So we call it Poulsbo Fire CARES. I need to stress that it's a partnership. It's a City of Poulsbo and Poulsbo Fire Department program. And that combination, I think, makes it really interesting and effective. We balance each other out and we have complementary but different interests in how we serve our community. And it started out very simply. It started out just like the police Navigator program. Let's stick a social worker in with the fire department and see how that can help fire crews responding to calls involving just behavioral health issues. Let's just see how it goes. Here we are about a year and a half later, and boy, have we learned a lot about community needs, about the best kind of response, about what's different than a police program when you're running something in the fire service. I'm happy to talk about any of these issues, but in a nutshell, Poulsbo Fire CARES is pairing now several behavioral health professionals with firefighters to both respond to 911 calls involving behavioral health, but more typically to follow up and come out after the 911 call to make sure people are connected to their primary care doctor, to behavioral health services, to aging and long-term care, to adult protective services, if that's appropriate, to family, to in-home services, et cetera, et cetera, et cetera. We do some 911 response, but I think the real power of this program is our ability to go and follow up and go back again and go back again and make sure people are getting the support that they need. I'll say one more thing, Anne, and then I will welcome your questions. I think the reason that you all invited me and the reason I'm so happy to be here is that almost 50% of our calls are related to adults 65 and over, not 15, 50. So much of what Fire CARES is doing is trying to figure out a more effective, more humane way to respond to older adults, most of them living independently, that are calling 911 because they're in some sort of crisis and they don't know where else to go. So that's the aspect of the program that I'm thinking you're interested in, and it's almost half of what we do.
You're absolutely right that that is one of the big ones, because of course we're the senior community center. And one of the things I've been really concerned about as a community leader in some respect is that I've had occasion myself to have to call adult protective services for neighbors in trouble. And I think a lot of people don't realize that more people are familiar with the concept of child protective services, but I think fewer people realize that there are also adult protective services and how they can help. Some people feel like they don't want to call because they don't want to get someone in trouble or create a problem bigger than the problem that they're trying to fix. But would you be willing to say a little bit about how that program works and especially relating to our communities here locally?
I'm a little hesitant, and just because I'm not an expert on adult protective services, I can only tell you how we work with adult protective services. So if that's something of interest to this group, I have lots of recommendations of folks that might come in and present. So let me give you my small perspective version. You know, we have found that working with adult protective services is absolutely invaluable when people are getting to the point that they're losing some managerial function or the ability to care for themselves, whether that's around health issues or around finances, around social issues. The thing about APS, they have excellent staff, they provide excellent services. It's not a heavy component on home-based services. A lot of what APS does is coordinate resources and help put plans together, but it's not an ongoing support service in the home, at least not that I've seen with the folks that we're trying to help. They're a great asset for us to get people more resources, but they don't do the sort of follow-up ongoing case management that folks on our Fire CARES team typically do. The other thing about APS that's really important to emphasize is it's a voluntary service. So unlike child protective services, which comes in and does an investigation and gets involved if there's some family risk or risk to little ones, somebody has to be willing to take adult protective services in order to get that system going. And frankly, there's a lot of seniors that we're helping that for whatever reason don't want that help. Maybe it's what they've heard about APS. Maybe it's pride in their ability to be self-sufficient. Maybe it's the style of APS, but we've had a lot of hesitancy for people to take advantage of APS services, I think, because of independence and maybe misconception about what APS help can bring. And again, I apologize, Anne, if I haven't done this justice, because I'm sure there's a whole menu of things that they offer that you can and should hear about. But from my perspective, because it's voluntary and because they don't have the capacity to do a lot of follow-up home visits for many of the people that we need help, I found them great as a resource in some instances, but perhaps not across the board.
Nancy,
Can't hear, Anne.
yeah, sorry. Nancy has a question.
Well, it was just a little tiny clarification, and maybe it's been clarified, but when you said voluntary, yeah, the APS is a voluntary thing. I wanted to know, the people who provide it are professionals, and you're saying that the people
Yes.
who ask for it are voluntarily requesting it as opposed to being court ordered or whatever else to be.
Exactly, Nancy.
Okay,
Thank you for that clarification. Yeah.
Okay, just
So, and by the way, I wanted to say to anybody, if you have a question, go ahead and put it in the chat, because sometimes I don't, if somebody's using the, like on the big screen, I won't always see everybody on the little one. So go right ahead and jump in with any questions you might have that I might not be asking. But one of the things I wanted to know is like, so what's a typical, if there is such a thing, a typical senior call, and how does the follow-up work?
Yeah. And thank you for hesitating before you say typical, because nothing is typical, but the kinds of calls we see frequently relate to things like cognitive decline. So, you know, somebody on Bainbridge Island that's been doing a fine job living independently, but is struggling with memory loss and disorientation, forgets where they live, and is walking around the neighborhood confused about where they are and how to get help. Calling 911 is the immediate and appropriate response for somebody in crisis in that situation. And what a typical fire response would be to help that individual get back into their home, ensure they're safe, and then go on to the next call. What a fire cares response would be coming to the home, sitting with the individual and learning more about their situation. If they're isolated, finding out if there are family supports that perhaps don't understand what's happening with their loved one or somebody in their family, and reaching out to the family and helping them understand what's happening with their mom or their dad or their brother. If the individual is willing to work with us, we offer case management services. So when somebody is struggling with memory loss, there's often other things that are not going well either. Maybe diet, maybe ability to go to the doctor. We're not constrained to one particular area. We're not constrained to just primary care. We can work with people on nutrition. We can work with people on getting to a counselor or a dementia specialist, or just knowing about support groups that might be in the area. So again, the typical fire response is keeping somebody safe and making sure that the particular situation is stable and the individual is taken care of in the moment. What's so useful and impactful about a fire cares approach is that ability to come and sit and listen and learn, make connections to family members and other entities and agencies, and most importantly, come back again and again. It's not a one-time or a two-time process. We can keep going back until we think that somebody's got connected to the sports that they need.
That's what I was going to ask you next. Is like, I've heard that there is this follow-up, but it wasn't ever very clear what follow-up looks like. So it sounds like you do have a lot of leeway about how much follow-up is allowed.
Yeah, I mean, the constraints, and forgive me. Let me drink out of my fire bottle of water once again.
Let's all drink. The smoky air is not doing any of us any favors.
Well, it's that or the candy bar, Anne. Thank you. Let me back up. We're so unlike programs that operate out of places like adult and long-term care, or Kitsap Mental Health, or Peninsula Community Healthcare Service. We have so much more flexibility. The reason we have so much more flexibility is because we're funded by the city and the fire department, and grants that give us a lot of leeway to do what's needed, not just do what's paid for or what the checkbox tells us that we can do. So the fact that this is a city fire department partnership gives us the ability to say, coming to see you twice isn't addressing your needs, we'll come back another 5 times. Or instead of focusing on this one particular area, perhaps you're struggling with dementia, we can address many other things, social needs, nutrition needs. Like I said, people are complicated. And what I love about this program and programs like it is our team has the flexibility to address the underlying needs of individuals and not be constrained with just that one little piece of it that's being paid for.
Oh, you keep answering all my questions. I mean, before I've even asked them. So, because I was going to ask her about how this is funded, but it does sound like you have sufficient funding. So with good results, getting grants that support this program sounds like you're having good luck with that.
Yes and no. So the yes part is that the city of Poulsbo and the Poulsbo Fire Department are so committed to this program that they have dedicated ongoing funds to make sure it's sustainable. So the yes part is at its very basic level in Poulsbo, there will always be some form of Poulsbo Cares. But what we're interested in is a regional approach. We think there should be Cares team in Central, North, South Kitsap. We think that we should have 24/7 coverage. We think that we should have specialists on our team. I'm hiring at the moment for a geriatric case manager who specifically can address the needs of older adults and have expertise in coming and sitting and assessing the needs of the older people that we're trying to serve. So we have a core team that's sustained, but there's so much more that we can do in terms of expansion, hours and services offered that I would not say we're adequately funded, and we're very eager to work with our partners to get funding so we can expand the reach of this program.
Well, and you and I have talked a little bit about how Bainbridge Islanders might possibly be able to benefit from some of this already. So I maybe discuss that a little bit, but then also tell us what steps we might want to take to bring the program here or encourage.
Excellent. Thank you for that invitation. Yes, at the moment, Bainbridge is included in our area of service. So Poulsbo Fire serves Bainbridge Island. There are criteria in order for somebody on Bainbridge Island to get help from the CARES team. Unfortunately, we're not at the point with staffing that you can just pick up the phone and request it if you or somebody that you know might need this kind of service. Where we can help folks on Bainbridge Island, it doesn't have to be a senior, of course, anybody struggling with behavioral health issues, and we define that very broadly: mental health issues, substance use issues, cognitive decline. Anyone struggling with behavioral health issues that's using the 911 system to address their needs can request a CARES follow-up or a consultation with the CARES team. So we're looking to get involved where that line crosses into the world of 911. And the reason we have to be picky like that, I mean, look, if it was my way, anybody could call this program anytime. But the point of this program is to reduce the use of 911 for non-emergency calls. So by our charter, by our goals and our mission, we get involved if somebody's using the 911 service to address issues that are better resolved with a community service instead of an emergency service. So again, if you know of anybody, if you yourself knows of somebody struggling with behavioral health issues from ages 0 to 100, whatever, if 911 is being utilized to fill needs inappropriately, that would be a great referral to the CARES team to do some follow-up and consultation.
And so as far as what we could do maybe to encourage Bainbridge, the city of Bainbridge and Bainbridge Fire Department to, what would they do? Network with you? Would they, join what you're doing or start a separate thing? I mean, how would that work, you think?
Yeah, so let's do the analogy to the wonderful program at Bainbridge Police, because I think that model might be one to consider. The city of Poulsbo started a police navigator program many years ago, and we served many different communities with that police mental health professional partnership. Over time, cities like Bainbridge realized how valuable its service it was that Poulsbo was providing for its residents, so they decided to start its own program. I'm forgetting now how long Kelsey has been with Bainbridge Police, but I think it's at least a couple of years. We started something here. It was taken over by the police department on Bainbridge Island, and as everything that I've heard is that it's serving the community and the police department in a really effective way. One path forward might be to keep encouraging people on Bainbridge to use the Poulsbo-based CARES program with an eye eventually to starting something, right, that serves Bainbridge Islanders. Certainly the need for it. I see it by the numbers. There's certainly a demand for it. I think maybe working with us now to get some of the systems in place and to understand the needs and to benefit from what we've been trying to do for a couple of years. A stronger partnership now might lead to an independent program later. Another way to look at it, Anne, and one that I'd be really excited about, is to really make a more effective 24/7 North Kitsap Bainbridge team. So residents throughout North Kitsap and Bainbridge have the same team with 24/7 capacity, responding both in the moment to crisis and to follow-up services. I like the regional approach.
I do too. And you know, that is brilliant because we are part of Kitsap, and Bainbridge tends to do our little bubble thing, but we serve each other so much better when we do it together. And you know, if we have big fires, Poulsbo's here, right? And same the other way, like Bainbridge firefighters may respond in Poulsbo as well. And so sort of building on that, I would love to see us create a stronger partnership, as you say. And now I guess I'm sort of wondering, like, so as citizens, how would we go about making our requests known? And it feels like we would benefit from some numbers. Like if that's something that Poulsbo CARES might be able to offer us, something like, well, X percentage of the people we are actually serving are really Bainbridge people. That would be a nice piece of information to be able to carry. Because I feel like Bainbridge is in the infancy stages in this. You know, we're getting started. COVID's been tough. That was a hard time to start, but things are just, you know, beginning to shift. And yet, you know, we do have an ever increasing population that's over 50 at least, and you know, quite a lot of people over 65.
Absolutely.
Yeah, no doubt about it. So putting more in place that will make sure that seniors really can benefit from this huge range of programs, I think would be awesome.
Yeah, I've been very inspired by Island Volunteer Caregivers, and I know you are all fans. That's an incredible organization. IVC has been very persistent, both with me and with Chief Turan at Bainbridge Fire Department. How can we access this program? How can we get more for the people that we're seeing? Because over at IVC, of course, the volunteers are seeing seniors that are using 911 for non-emergent needs frequently, and they know that the need is there for more services. So in terms of advocacy, I think, you know, communicating with the Bainbridge Island Fire Department about this model, congratulating them on how much they've supported it in the past. They've been wonderful partners. It's just been slow to get going. So just expressing your interest in seeing that partnership grow and more care services on Bainbridge would be a great way to go. I love the idea of numbers. Our numbers in serving Bainbridge Island are very small. I've got some stats in front of me. I think in all of 2021, we assisted 17 people on Bainbridge. The number is tiny. A much better number for you, Anne, would be to ask folks at Bainbridge Fire, how many behavioral health calls do you estimate that you're responding to each year? And how many of those behavioral health calls, right, could you give us some demographic information on? How many are 65 and older? And more anecdotally, how many times do you feel like you're going to the hospital with seniors and others on Bainbridge when more appropriate care might be had at home? And with that, I am going to share a slide. Reed, thank you for the ability. Hang on. This article is probably something that you've all seen from the Kitsap Sun back in late August, and it certainly was an eye-opener to me and many other people doing work in this area. The fire chiefs across Kitsap County are starting to become more and more vocal and upset about the wait times for ambulances at St. Michael's Medical Center. Right. So the traditional fire response, right, when somebody's calling 911 for help, take somebody to the emergency room. Well, what do we do now when waits for the emergency room are 5 and 6 and 7 and 8 hours long?
Mhm.
It is unconscionable to me to think that my mom calling 911 because she fell and she's scared or she heard something and it's related to a physical injury, that my mom would be waiting for 7 hours to get care at our local hospital. There has to be a better way. I'm not criticizing St. Michael's. This is part of a big and complicated picture about staffing and funding. I don't know enough to be, I don't know enough to know where the problems are, but I do know we have to find a better way. And doing more home-based services with a medical component, like Fire CARES, has to be an alternative that we're all advocating for in our communities, because this is unconscionable. This is unconscionable.
Yeah, you're totally right. And we hear that all the time. I recently was talking to a friend who waited 9 hours.
Oh my gosh.
Not for the first time. So yeah, it's, and you know, staffing, you're right. There are many, many factors, and that's not our task really. But I have several questions from listeners who are curious about might we access these services? Do we call the fire department? Do we talk to our doctor?
So if somebody's in this category that I described, using 911 to address underlying behavioral health issues that are non-emergent in nature, if that's the situation, I would strongly encourage a two-pronged approach, right? By all means, after that 911 call happens, reaching out to the fire department and requesting a CARES follow-up, by all means. But as an insurance policy, also reaching out to the fire CARES team as well, and making a request and referencing the fact that there was a 911 response. So I think, because this is new and I'm so eager to make sure that this partnership works, for the moment, I'm going to give you all my personal information. If this is a situation that you think would justify a CARES team involvement and there's 911 involvement, please reach out to me directly. My number here at the City of Poulsbo, I'll put it in the chat. It's 360-394-9794, and I'll put it in the chat as well.
That is
just to make sure. We need to get this right, Anne. I mean, we need to get this right. So please contact your fire department after a 911 call and request CARES directly, but just to make sure that the dots are being connected, reach out to me as well and let me know that you did that, and I'll make sure that our CARES team is aware of the situation.
That is very generous of you. But it makes me kind of think about visiting nurse and how that used to be really a pretty significant, I mean, for decades, that was a very strong part of community care. And that has sort of disappeared. And I don't know whether it's so much about the nursing shortage or if it's about community shift of attention. Do you have any?
There's an analogy over in mental health, Anne. Social workers and people that worked for our community behavioral health agencies used to do house calls. They used to do field visits. So much of medicine was related to meeting people literally where they're at and going out in the community and making those connections. That disappeared as well. And, you know, it's complicated. Some of it has to do with risk. Some of it has to do with the way insurance reimburses. Some of it has to do with, you know, being able to serve more people in one location rather than the time it takes to go around. Some of it is a nursing shortage. I mean, there's so many factors, but the bottom line remains the same. There are many people that need and would benefit from home-based community services, and we have less and less opportunities to offer that. That's the gap that the CARES team is trying to fill.
It's certainly one of the big ones. I have another question about how this might relate to policing. On Bainbridge, I don't know if you're aware that there's this whole Reimagine Public Safety campaign for so many police are not trained to respond well to behavioral issues. And so is that something that you would you could see being part of? I mean, does Poulsbo CARES connect with the police department at all, or is it?
Oh my gosh, yes.
Yes.
So, okay, you're going to hear a very opinionated personal answer because I live on Bainbridge and I worked with your police department for about a decade on these issues. So here's a very personal response. The police department on Bainbridge Island has improved, evolved, achieved so much in the last decade. I am so impressed with that police department. And I mean, I don't know if folks on this call have a long memory for this sort of thing. It was there was an absolutely horrible incident involving a man with schizophrenia back in 2010 named Doug Osling,
Right.
which resulted in a lawsuit and a city settlement and outside involvement and people like me making a lot of noise about the importance of doing things better when it comes to policing and mental health. And Bainbridge Island changed. I can't say enough about the quality that I see from my hometown department now. The fact that they brought on a social worker to be a part of their department. The fact that they're trying to train all of their officers in 40 hours crisis intervention team training. The fact that when my son, you guys don't know my son, you only know Gigi. When my son, who's a skateboarder that perhaps goes places where he shouldn't be skateboarding, is treated with just, with such decency and respect by officers that seem to take it as their responsibility to make sure our young guy is doing okay and knows the difference between what's permitted and not permitted, but also knows that the police department cares. I can't say enough about the police department. That said, there's always room for improvement. And I would say the same for my hometown police department that I'm also incredibly impressed with. Calls involving mental illness are incredibly complicated, variable, sometimes dangerous. And even the best intentioned department that's had training and is thinking about these issues can always do better. So I'm in no way saying that any of these departments have reached their highest point. This is a continuing process of dedicating hours to training and understanding how important it is to get these calls right. I just think that, again, as a Bainbridge resident, I wouldn't think of this as so much reimagining public safety, but encouraging Bainbridge Island Police to keep doing what it's doing and keep raising its quality of response. That was a long-winded answer. In terms of how Fire CARES combines with police programs, there's a critical connection. I mentioned earlier in my comments that we do a lot that's different than a police program, but there's some really interesting overlap. When there's a 911 call involving behavioral health issues, typically substance use or mental illness, where there is an element of danger, and that happens. Mm-hmm. When there's a risk of self-harm or a risk to hurting other people, police have to get involved. And in those situations, right, there's often a really useful overlap with a fire program, because a fire program might be able to help on scene with, let's say, a transport to the hospital. Or it might be able to help after the fact, after somebody is discharged from the hospital or an inpatient unit. Fire CARES has the capacity to do that sort of long-term ongoing follow-up that most police programs don't do. So I like the partnership in situations where police presence is appropriate, where there's danger. And I like the partnership where police are able to make referrals and pass off to the Fire CARES to do ongoing follow-up after that police involvement is no longer necessary. And it's happening. I mean, we've had some really successful partnerships with Kelsey on Bainbridge when she reaches out and works with our team because she's helping somebody but realizes the limits of police assistance and then wants to call in a fire response. I wouldn't say we're doing it all the time, but we've done it and we're showing the success of it. And I hope we can keep building on that.
It seems critical that be an element that's at least very much enmeshed in some sense, that there's got to be a lot of handoffs there, right?
It's got to be a partnership.
Yeah, exactly. One question is, isn't the idea to avoid using 911 calls for behavioral issues? Yet it sounds like this system only applies to people who have made a 911 call and then need more help.
Yep.
So is that
great question? Great question. I bet many people listening to this have heard about the rollout of 988, both in Washington State and elsewhere. Mm-hmm. Thanks to a federal mandate and some state funding, you're now able to call 988 to address behavioral health needs that are non-emergent in nature. And I am a member of the state committee that's trying to roll out 988 in an effective way. I'm an advocate for 988 and a strong believer that there are many calls involving behavioral health that do not need fire or police to resolve. Many calls. However, there are some calls that involve danger or criminality or medical need where 911 response is not only appropriate, but it's absolutely life-saving. So my world is figuring out, how do we make that 911 system more responsive, more humane, more effective when it comes to those kinds of behavioral health calls, and keep encouraging other systems to take care of the other kinds of calls? How do we do the best we can in the 911 context while continuing to advocate for more of these non-medical, non-emergency, non-dangerous calls to go to other parts of the system? Here's the bad news. It's what I've been dealing with for 5 years of running these programs from Poulsbo. Even though the right response to many behavioral health calls is not 911, we don't have systems to respond quickly and effectively in the field to those calls yet. Maybe we will. I hope we will. I'm working to make sure we will. But at this moment, if my uncle decided to try to take his life and hurt himself, there is nobody else for me to call other than 911 to get the assistance that he needs. And that's just a shame.
Right.
But 911 will keep coming. And so what I'm trying to do here with my partners in Poulsbo, with the city and the fire department, is make sure when that 911 system is used, we have an appropriate response.
And that requires a lot of staff, doesn't it?
If we were doing this, if we were doing this 24/7 and could respond to every need, it would require a great deal of staffing. What we've done instead in trying to show the usefulness of these kinds of programs is start small and start with one social worker and one firefighter. We've recently grown to 2 social workers, 1 substance use disorder professional, 1 firefighter, and some firefighters working overtime. So we're gradually growing. If it was adequately staffed, and yes, it would require a lot of staff because we'd have a 24/7 response.
Like so many things. I have a question here. 911 is well staffed. 911, which could be argued, but yes. How well staffed is the 988 group?
Staffing's not the problem, I'm happy to say. Every time you get your phone bill, there's a little surcharge that's used for staffing 988 call centers. It's not specifically just for staffing, it's to help with the rollout of 988 more generally. But so far, funds that have been collected through the new telecom surcharge are being used to make sure that the 988 call centers are adequately staffed. And through my work at the state level, working with this thing called the Crisis Response Improvement Systems Committee, I know firsthand that the 3 hubs in Washington state that are taking 988 calls, they have lots of funding to bring on staff quickly to answer the calls. I don't think that's the main challenge right now. I think the main challenge has to do with training these people up quickly. I think the main challenge has to be making sure that the person that answers the phone has enough knowledge about local resources that they can make good recommendations for where to go for follow-up care. I think the problem, frankly, is that we don't have enough field response, and you can answer the phone adequately and help most people that need help with a phone call. But for those smaller percentage of folks that need a home-based or community visit, we don't have the systems in place yet to adequately respond.
Well, and it's my understanding, just like we're seeing staff shortages at St. Michael's and other medical facilities, we really need to do something to engage younger people in some of these.
Yes.
Right? I mean, isn't that a
Yes.
issue? It's like, why are nurses quitting in droves? Why? Partly it's COVID and the burnout that has been experienced. But as we're seeing throughout the whole, and this probably drifts a little far afield for our conversation, but that's me. Look at that big picture. Like younger people are saying, why should I try to work with a broken system or whatever their thing is? And yet, how can we create an environment or programs, education, work with, Olympic College? I don't know, but like making it really attractive. I'm thinking about how Washington State ferries, when they are faced with enormous numbers of older, longtime staff leaving, retiring, so they've reduced some of the barriers to getting involved there. Like it used to cost $100 to even take the tests and stuff. Well, they're realizing people aren't maybe going to do that. So removing some of those barriers to ongoing education, removing some of the barriers, but also maybe incentives. I think a lot of people would be more interested in in training in mental health if they understood how many job opportunities and how varied they might be. So some of that work, and I don't exactly.
Oh my gosh,
know how that works,
you're making my heart beat faster, Anne. I mean, of course. And one of my favorite things about living on Bainbridge Island, right? There's so many talented people that could help solve this problem, at least in a partial way. There are so many people that are connected to educational institutions, to people that can make political decisions on the state level, that have ideas about how to create incentives. The way you introduced your comments were involving the youth. I have 2 high school students that, are always looking for volunteer opportunities because that's part of the expectation at Bainbridge High School. But to get my daughter experience in mental health, I had to find her an opportunity in Bellevue. I would so support and do anything that I could to support more opportunities within the high school to educate young people that want to make a meaningful difference about the kind of career paths and the kind of student loan incentives and things like the fact that at the UW, that the Balmer family has created a free education track for people that are interested in getting a master's degree in a mental health related field. I mean, there are opportunities out there, but I don't think our kids are being taught about them. So any ideas that you or others from this group have about opening more people's eyes about this career path, I would so strongly support.
Reed just said he thinks we should need to talk to Courtney at Bainbridge Youth Services, and that is certainly a place to start. And that's the thing, you're right. The Bainbridge is really rich in resources, in human resources. In other words, not just the HR of the corporation, but the fact that so many of us are well educated and well connected. And it's like using our privilege, our enormous privilege, to work for the better good of the whole community is a really worthy way as elders that we can step up and do some of this work and encourage other people in positions to affect change to get on it and do some. So
beautiful.
Yeah, but how do we start, right? What does that look like? What's encouraging and what's just another push? I think people are a little burned out on things to care about. I'm sorry. But, ironically, that leads to more mental health issues and emotional health issues. And so we need to kind of harness some of that energy and say, well, let's do something about it. Let's do something about the fact that everybody is depressed and stressed and anxious these days.
Well, how about this? Because I never turned down the challenge of throwing out an unthought idea. How about this? If there was a more developed fire cares program on Bainbridge Island, what an interesting opportunity that would be for internships or for what they used to call fire cadets to come into the fire service and see firsthand. This is the lecture I give to my daughter. You don't need to go to another country to understand what human needs look like and to understand what vulnerable adults or children look like and figure out ways to assist. You don't have to go across the world. There's so much work to be done in our own communities. Even on privileged Bainbridge Island, where so many people are blessed with resources, our team goes to calls constantly of people that just are disconnected from care and are struggling in ways that it's even hard for me to, I just don't care to explain because they're just so upsetting. Down your street, right? Down the next road over. And the only way I think that you'd be able to communicate this to students, because you don't often see it on Bainbridge. It's at the end of a long driveway. People keep their issues and their problems very close to the chest on Bainbridge Island. The way that you start to understand it is working with first responders, because this is that 911 call comes in, like these are the men and women that are responding to the people that don't want others to know about their struggles. So I don't want to overstate this, Anne. I'm not saying that kids should be volunteering with the fire department to learn everybody else's business, but it really is an eye-opener when you spend time with first responders to see how much needs there are in your backyard. And if this was a side effect of fire cares having more of a presence on Bainbridge, I think it would be a good thing.
Well, there's the police academy where citizens are invited every year to take classes, and also they used to anyway do some drive arounds with an officer.
Yeah, they still do.
They still do.
Yep.
Okay, thank you,
Yeah.
Nancy. I thought for COVID, maybe they were stopped, but if they
No,
started again, that's
absolutely.
great. But that's an annual opportunity. And maybe we can ask for more opportunities like that.
Yep.
Do you have a senior special we could sign up for? Right. And, maybe there's
Yes.
a way to partner with high school kids. I
Right.
mean, seniors and high school kids actually have partnered very successfully on some projects.
I have if anybody was going to do it, it would be Island Volunteer Caregivers. I steal as many ideas as they can for them. For example, based on something that they're already doing on Bainbridge Island, City of Poulsbo is starting an initiative this month called Senior Cares, where we're matching volunteers in the community with isolated seniors that could use a friendly phone call. And we're just starting a regularized phone check-in program with volunteers and with seniors. I would love nothing more than if we could get some young people involved in this program just to make that human connection amongst the generations and have both sides of that phone call better understand each other. I think involving people across the age line, but especially youth in projects that maybe open their eyes to the needs of others is absolutely essential.
Oh, totally. And, during COVID, we did some of that here at the senior center too, of course, making those calls and
Oh,
checking in with
awesome.
people quite a bit. But we also started to create relationships with some of the high school kids who were
Beautiful.
at home and on their devices, as everybody was, and created some very meaningful relationships that are still ongoing. I just still hear from some of the kids who were seniors and graduated and are on to other adventures all over the place, checking in, letting me know what they're up to, and I think one of the pieces we can offer is that we are elders and we actually have some perspective to offer that can be really helpful for young people. So yeah, I mean, I love that. Sheila, you have a question.
No question. I just want to say amen.
Oh, you're clapping. Sorry, I couldn't tell what that was. It was a yes, yes. Yeah,
Well,
amen.
yeah,
Exactly.
I mean, I've been fortunate to be blessed to be able to have Gigi. So yeah, absolutely. Actually, I've had two experiences. I with Gigi, then with a young lad, I don't remember his name, that we met together at the senior center. And it was, there have been things that have gone on. I think it would be great to be able to continue that.
Well, exactly.
But
And,
of course, I'm lucky because I had Gigi.
but we're all lucky in that we have the opportunity to connect on various levels, whether it's a young person coming to do our silver tech and showing us how we're supposed to use our phones. I mean, I'm sorry, but I'm right up there at the front of the line on those sometimes. But we do have a lot to offer each other, and I'd love to see some of those barriers come down too. So we're always looking for more multi-generational programs. But kind of swinging back here to this whole, how can we really help Bainbridge work harder on this, maybe a shared project at first? Would we talk to city council? Would we start with the fire department? Would we, what do you think is effective?
Yeah, I learned long ago in trying to set up programs that it's always the best to understand the needs of the agency that you want to make the change. So my strong suggestion would be, and you have a wonderful chief, you have a there's great folks over at the fire department. I'd go to Chief Turan and just, ask him how he thinks this could work. Because I could give you my own, brilliant model of how this would be the most effective, but it won't work. I mean, if this doesn't come out of an organic need that the fire department already sees, an interest that the fire department already has, it won't be successful. So I can tell you, I've had many conversations with some folks over at Bainbridge Fire. The interest is there. I think they have so many obligations, and COVID was such a barrier, and there's so many competing demands that it probably would just take a few people's comments or conversations to help maybe focus a little more attention on this issue.
Well, and I know like some of our first responders are coming from a long way away. They're not necessarily living in our community, and not just because Bainbridge is so darn expensive, but because again, there's not as many trained EMTs as there were.
Yeah.
And younger ones are in hot demand.
Yep.
So, anything we can do as a community to make that more attractive. Again, so I think that's a great suggestion. And I think, Reed, it sounds like we need to organize another program where we can talk to the fire department in some depth and also with the police department, because I don't know if you saw, Kim, that they've just hired 4 new officers, one of whom has quite a lot of social work background.
Oh,
And
good.
some of them have really interest. One is a gay man married to another person with good social service background.
Awesome.
Yeah, it's more diverse than it has been, and I think that's just great. So we're moving, but wanting to not push the river, but really sort of help build programs that really will benefit us. And I think one of the issues that might be a little tricky is that there still is a certain kind of stigma around the need for mental health support or behavior.
Oh my gosh. Oh my gosh.
Still
Bainbridge is infamous county-wide. Again, I'm a resident of Bainbridge. I love my community. The reputation among those of us doing this work is that on Bainbridge Island, there's so much stigma. It's not my child. It's not my mother. I don't need the help. It's unique on Bainbridge. Stigma is real. Stigma is everywhere, but the extent of it, and the pride, right? There are so many folks that are aging in place that need help, but just don't want to ask for it on Bainbridge Island. And I understand. I mean, there are so many talented people that have governed organizations and told others what to do for their whole careers. And now it's time for them to accept help. And it's very difficult for a lot of folks that live on the island. It's an interesting community to serve.
Well, and that brings out the point that we should probably be looking at developing some training programs on how to ask for help. I remember writing a couple little articles for our newsletter during COVID on exactly that. Like, there are actually programs that help you practice asking for help.
Excellent.
And maybe we need to do a little more of that, right?
Another way, I'm sorry, Anne, like another asset to having the Fire Cares team already serving Bainbridge. If you ever thought it might be useful to have our Cares firefighter and one of our social workers come in and talk about what signs might be that somebody's in psychological distress, even when they're not asking for help. You don't need a 911 connection for us to come and do an educational presentation. And we really welcome that opportunity to come and talk to people about, signs of suicidality, signs of alcohol or substance use abuse, early signs of memory issues, effective ways to approach people that are starting to struggle with these issues. There's all sorts of things that we could talk about. So anytime you want to invite us in to do a more practical presentation, it would be our pleasure to do so.
You are on. We'll definitely be calling you for that one. And we have your number. Well, I just wonder if there's anything we haven't hit on that you'd sort of thought about before as being an important thing to bring up. Or we've certainly covered a fair amount of ground here, but
I will repeat something that I said. I'll repeat something that I said and make a request. So something I mentioned earlier is that we are blessed with the funding to bring somebody on the team part-time to really specialize in the needs of older adults that are calling 911. We're calling it a geriatric case manager. I just know from my experience on Bainbridge, sometimes when I throw things out casually, the perfect applicant is listening. So if anybody is listening to this recording or is on the line, has some experience working social work, physical therapy with older adults, and is interested in a part-time job that I promise will be very interesting, we are hiring for that part-time position. The thing that I would like to emphasize is, and you hit on this before, we are all in this together, right? This is a Kitsap County issue. The needs of our older adults is something that we all need to be paying closer attention to. And the more we can join together and do it as lots of communities instead of just one in Poulsbo or in Bainbridge, I love that spirit that you brought to this call, and any opportunity that I could have to find that bridge between our city council and your city council, your city manager and our mayor, your fire department, our fire department. We are just stronger together, and I really appreciate that orientation.
Oh, this is wonderful. Does anyone have a question that we haven't covered? I can't tell. Well, it looks like we are just indebted to you. Thank you so much. This has been great because I really had a lot of questions, which you did cover, because I feel again that, this is such a community builder, and not just for Bainbridge, but for the community of Kitsap and beyond. And every
That's right.
time we manage to pull off a community model, they do get adopted all over the place, which is great. So if we consider it a seed project, that's something we can work on Bainbridge and with Poulsbo, maybe with Suquamish, this could be really valuable for a lot of people, and I'd love to see that. So again, thank you so much for your generosity and your time and your amazing perspective.
Wow. This has been such an honor. So happy to have the opportunity, and you're all welcome to call me to talk about particular needs or more general program ideas. I'd welcome both kinds of calls.
Well, thank you. And you will be hearing from us again. I
Good.
promise you
Good.
that. Thanks, everybody.
Bye, everybody.